Why women are romantically aroused when menstruating. We're here to assure you that while it may appear unusual, it's entirely normal. Women experience romantic feelings during their periods for a number of reasons. It could be psychological, hormonal, or just a simple need for emotional closeness. Our mood swings are caused by hormones such as DHEA, progesterone, testosterone, and estrogen going crazy during the menstrual cycle. Studies show that these hormonal cycle rise and fall has a major impact on our libido or sexual desire and can even heighten it. The estrogen level first decreases and then gradually rises during menstruation, which has a good impact on our desire for sexual activity. Progesterone levels begin to decline at the same time, which may cause women to feel even more erotic. It's also thought that psychology has a role in heightened sex drive and amorous feelings during periods. Studies show that women who experience ongoing stress are less likely to be sexually attracted to others. Women who are anxious about irregular or delayed periods may find some relief in the fact that they are experiencing them. These ladies may acquire a desire for sex as a result of this relief. The increased blood flow to the vaginal and pelvic regions during menstruation is another factor contributing to women's feelings of this sort. Due to enhanced circulation, those areas are more likely to become sensitive, which raises libido. Is it safe to have sex when menstruating? Yes, is the response. It is appropriate to have sex when one's period is coming or going. Studies show that most women believe it is okay to act on their emotions and have sex when they are on their periods in order to decompress or maintain an emotional bond. It is appropriate to have sex when one's period is coming or going. Here are some important things to remember when having sex when you're on your period. Even though the menstrual discharge is supposed to offer sufficient lubrication in the area for smooth sexual activity, you can apply a lubricant with a silicone or water base if necessary. Shorter periods might result from having sexual activity, which can hasten the process of uterine lining loss and menstrual discharge. Having sex at that time of the month can be rather calming. Endorphins like oxytocin and dopamine are known to be released during orgasms, and these endorphins can help relieve tension, worry, and sadness. Cramps are brought on by the uterus contracting to remove its lining. Orgasms, on the other hand, aid in the relaxation of the uterine muscles, which can relieve some of the tension there. A lot of women experience migraines during their periods. Studies have shown that having sex can help with migraines and headaches. There are obvious reasons why having sex during your period would always be nasty. That's why you should always have tissues and towels on available, practice your foreplay again, use a menstrual cup for oral sex, and most importantly, talk to your partner about how it works. During your period, you run the risk of getting STIs such as syphilis, genital herpes, and chlamydial infection. You shouldn't take a chance by engaging in unprotected sexual activity. A common misconception among women is that they cannot become pregnant when they are menstruating. Unless you're aiming to conceive, you should always take protective or contraceptive methods during sexual activity to avoid pregnancy. Romantic or sexual feelings are common during menstruation. However, most women choose to repress this emotion rather than express it or take action. Though it's fair to worry that our spouse might not be interested, if we don't talk to them about it, we'll never find out. There's also always the choice to do it alone.